restorative dysphagia treatment, compensatory dysphagia treatment, adaptive dysphagia treatment. Today, we are talking dysphagia treatment options, restorative treatment versus compensatory treatment versus adaptive treatment. Let's go. Hi everyone, I'm Erin and I am a speech language pathologist. Today, we are talking dysphagia treatment options. Specifically, we are going to talk about the differences between restorative treatment, compensatory treatment, and adaptive treatment, because they're confusing. Therapy falls into three distinct categories: restorative or rehabilitative treatment options, compensatory treatment options, and adaptive treatment options. And choosing one depends entirely on your clinical goal. Restorative treatment aims to change physiology long-term. Examples include the Mendelssohn maneuver to increase upper esophageal opening duration, the Shakir or chin tuck against resistance to strengthen suprahyoid muscles, and progressive lingual resistance exercises to increase tongue pressure and general lingual control. Using restorative exercises when the patient has the capacity to improve can reliably enhance swallowing safety, function, and efficiency. Next, let's talk about compensatory treatment options. Compensatory strategies produce immediate safety during eating, but do not change physiology long term. Examples of compensatory strategies include chin tucks, head turns, pacing, altering a bolus size, double swallows. Using compensations when you need to make a patient safe right now while you work on restorative therapy or await instrumental testing is often really indicated in order to enhance, again, that swallowing safety, function, and efficiency as much as possible. Finally, let's talk about those adaptive treatment approaches. Adaptive strategies are structural or long-term supports. Those can include textural modifications, alternative feeding routes such as a PEG or an NG tube, environmental or caregiver changes, or assistive devices. Using adaptive approaches when restoration is unlikely or if a disease is progressive helps to prioritize nutrition, hydration, and patient-centered goals. Now, let's talk a little bit about a decision tree. If immediate safety is the priority, use compensatory strategies. If physiologic recovery is possible and the patient can train, you're going to use restorative options. If long-term feeding or a progressive disease is the focus, use adaptive strategies. All therapies should always be reevaluated periodically or be reevaluated during patient change, which is very common in long-term care populations. Oftentimes you'll see someone improve and then someone decline. Reassessment is indicated whenever those improvements, declines, or general changes in function occur.